My name is Ashley Pulskamp. This is speech number 3, my persuasive speech, and it's called The Clinical Field of Psychology. What is going on today? How do you experience these feelings, and what types of thoughts or actions provoke these feelings to become stronger? Feel as if you're sitting through an interview? Well, that is what a clinical assessment can be thought of. A clinical assessment is the process of gathering information about a person in relation to their environment in order for the best interest of that individual. There are 5 steps involved during a clinical assessment. Throughout my 3 years of college, while pursuing a degree in the clinical field of psychology, it has caught my undivided attention without question. I am going to present to you the knowledge that I have gained along with additional research on this topic for my speech today. Today I would like to inform you of the background of clinical psychology, the steps taken during a clinical assessment, and the issues that could appear during the assessment. Many people may wonder, who are clinical psychologists and what do they do? This branch of psychology is devoted to the discovery and application of scientifically derived principles of human behavior for the purpose of improving the health and well-being of an individual. According to the Bureau of Labor Statistics, 34% of psychologists are self-employed, mainly in a self-practice or as independent consultants. Things that are involved within this occupation include research, teachings, and services relevant to the applications and principles method, and procedures for the understandings, predicting intellectual, emotional, biological, psychological, social, and behavioral maladjustments. The field of clinical psychology seeks people who demonstrate a unique perspective. Regardless of the training model, clinicians seek to apply scientific findings in individual cases and to do so on a deeply personal level. The field requires individuals who possess a strong and compassionate interest in the welfare of others. According to clinical psychologist Dr. Doug Selding, the most successful candidates for training are typically individuals who have interest, demonstrate honesty and integrity, have interpersonal relationships, and are personally emotionally stable. Clinicians share the same common knowledge as other psychologists, but seek to apply that knowledge to the task of helping people in psychological distress. This is referred to as the clinical attitude. Now that you have a solid understanding on the field of clinical psychology, let's discuss the clinical assessment involved and the steps taken within the assessment. The clinical assessment is not just a process, it is a way of thinking. There are 5 crucial steps throughout this assessment as well. A diagnosis is not the assessment, it is one of the goals of the assessment. Throughout the assessment, information is gathered, but this process is influenced by the therapist's experience. Thus, it intermingles description, explanation, and prediction, and is a way of thinking. Dr. Selding stated that one of the best interview questions is to ask, well, how does so-and-so react to this? In the blank, they will insert the patient's boss, spouse, or parent. This has helped to gain additional information on their environment. The first task is to clarify the referral and decide what is being assessed. The therapist generates a set of questions and wants to assess variables associated within the nature, history, maintenance, and fluctuations of the problem. They must break into the patient's belief system, or in other words, how does the patient perceive themselves? The second step is to plan out data collection. What do you want to accomplish as a result of your assessment? This is completed through 8 common goals such as diagnosis, forensics, and developing assignments for therapy. The third step in this is planning the data collection or selecting standards for making these decisions. The therapist will need to determine how this will be done by utilizing normative standards or self-reference standards for both. Data collection can come through both formal and semi-formal assessment. Also, data collection can be achieved through psychological tests such as aptitude tests, achievement tests, intelligence tests, and personality tests. The fourth step is a critical step that bears heavily on the basic ethical charge to do good and to do no harm to the individual. In synthesizing all assessment information, the therapist seeks to describe, explain, and predict that is fair and accurate. Finally, the 5th step is to make a decision and judgments. That is when they will produce a case study. And here is an example case study for my audience to view on one of Dr. Doug's past clients. Dr. Kellogg, who has also acquired a PhD in psychology, stated in his interview, "It is a fact that therapists use their prior experience to better understand each new case. Like all professionals, they develop a personal internal norm, and this is what experienced therapists are better than novice ones." This brief overview of the 5 crucial steps to clinical assessment comes with a few issues in order to continue the process. The first is the bandwidth issue, which refers to the span of topics assessed. Second, the fidelity issue refers to the level of depth to which any one issue is explored. These are related in an introverted fashion. Basically, how many different things do you want to or are willing to assess throughout the assessment? The level of inference is an issue as well. Clinicians vary in the level to which they will go in making inferences based upon their assessment. Some clinicians will stray very far from the cold hard facts, while others will go to a much greater extent in interpreting the data that they are given. As we have seen, the clinical field of psychology is for those with a strong devotion, interest, and well-being of the others who are emotionally strong and stable. A clinical assessment is time-consuming and requires a lot of attention from the therapist in order to come up with the treatment plan best suited for that individual patient. I hope one day to be conducting clinical assessments on my own out of my own practice. Through schooling and interaction, I hope to gain the knowledge necessary to treat those in great need of psychological, behavioral, and cognitive assistance.